Hello everybody and welcome to Business 80, Medical Terminology and Anatomy. And today we're going to be talking about Chapter 7, the Respiratory System. So let's get started. The respiratory system, it's the system that helps us breathe. Pretty obvious, I think, to most of us. It's the system that allows us to take in oxygen, to expel carbon dioxide, and to allow us to live. Okay, so there are, when we talk about the system and the structure of the system, let's start with the upper respiratory tract, which is basically the nose and the throat area. Okay, the nose filters out foreign substances, foreign particles. That's why we have hair in our nose. And then there's three sections of the pharynx, and the pharynx is this tube that's kind of down the back from the nose down to the top of the trachea and the esophagus. And that pharynx has three sections. And when we break down these words like nasopharynx, naso means nose. Okay, so that's the part from the nose to the pharynx to the tube. Okay, the oropharynx, oro is pertaining to mouth or oral. And then the laryngopharynx, the larynx is the voice box, and that connects the pharynx with the trachea, and the trachea is the windpipe. Okay. Now, one of the things that I would say is a lot of people pronounce larynx incorrectly. Many people like to pronounce it the larynx, just like pharynx. People pronounce it the pharynx. Incorrect, and simply look at the spelling of the word. Okay, pharynx, it's not nix. N doesn't come before the R, so it has to be pharynx. Same thing with larynx, L-A-R, not L-A-N. Okay, so it's L-A-R, larynx. So make sure that you pronounce that correctly. Okay, good diagram of these things, and we can take a look at. You guys can take a look at that one on your own. Okay. Now the lower respiratory tract is kind of getting from the trachea down to the lungs. Okay. So the trachea is the windpipe. That's where it sends air from the outside into the lungs to fill up the lungs. Okay. It's lined with cilia, and cilia are like real fine hair-like projections. And that helps to again continue to filter out waste particles. Okay. Now the bronchi branches. They're little smaller airways, is what the bronchi are. Okay. So smaller airways on the left and the right, and then those branch out into 5 smaller bronchioles. Okay. The bronchioles enter each lung, and then because there's 5 of them, there's 3 lobes in the left lung, in the right lung, and there's 2 lobes in the left lung, and those bronchioles enter the lungs that way. Okay, so if you can remember 5 smaller bronchioles that branch off the bronchi, and 3 of those bronchioles go into the right lung and 2 into the left lung, and then that leads into the alveolar sacs, which contain the alveoli, and the alveoli exchange oxygen for carbon dioxide. So basically off of this slide, if you just consider this all in order, okay, the trachea, the windpipe, leads to the bronchi, the 2 smaller branches that lead to each lung. And then the bronchi branch out into the bronchioles, and then the bronchioles branch out into the alveoli. Okay. The lungs. So right lung has 3 lobes, left lung has 2 lobes. Okay. And then they're lined with pleura. And the pleura is a membrane that encloses the 2 layers of the lungs, and that's the visceral and the parietal layers. Okay, so 2 layers of the lungs. The visceral pleura, they hug the entire lung surface, including the spaces in between the lobes. The parietal pleura covers the sides of the pericardium, from the chest wall back to the spine. Okay, and then the mediastinum is the space between the lungs, which contains the heart, the pericardium, the thoracic aorta, the pulmonary and artery veins. It's that space in between the lungs. Okay, and then serous fluid is in that pleural space, and that serous fluid lubricates the pleural surfaces and actually aids in allowing the lungs to move freely during inspiration and expiration. Okay. So the thoracic cage contains bones and cartilage that protect the lungs. So we're talking about the rib cage or the thoracic cage, okay, which contains the sternum, and the sternum basically has three parts to the sternum. So you have the manubrium, which is the top of the sternum. It's a little bit wider. Then you have the sternum, and then at the bottom, the very bottom of the sternum, is the xiphoid process. Sometimes we call it the xiphoid tip. This is often referenced when we're talking about CPR, cardiopulmonary resuscitation, because you can break that xiphoid process off pretty easily if you're doing chest compressions adequately. Okay. Let's see. Respiration. Respiration occurs in two different forms: external respiration and internal respiration. Okay. External respiration is when we take oxygen from the outside, when we breathe in oxygen. Okay, so external respiration refers to a gas exchange between inhaled air and blood. Okay, where internal respiration refers to gas exchange between blood and tissue, or tissue fluids and tissue cells. Okay, and then oxygen moves from the lungs into the blood during internal respiration. Okay, so just think of external respiration as being taking oxygen from outside into the body, and then internal respiration being that exchange of oxygen, the gas exchange between blood and tissues. Okay, some physical exam terms. Anoxia, the absence of oxygen in inhaled air, body tissues, or arterial blood. Anoxia happens when your body or brain completely loses its oxygen supply. Okay, so obviously very serious. Good term, auscultation. I believe I've mentioned this before. Auscultation is the sense of listening, or the sense of sound. We auscultate for lung sounds. When a provider puts a stethoscope on and they listen to your back, they're listening for lung sounds and breathing sounds. They're auscultating. Okay. Bronchospasm, very common term, a contraction of the muscle of the bronchi that causes a narrowing of the airway. Cyanosis, we've hit before, cyan being blue, so a bluish discoloration from lack of oxygen. Hemoptysis, that's a good one. Hemoptysis is coughing up blood. Okay. And orthopnea. Orthopnea is breathing discomfort, when you're laying down flat on your back. That goes away when we sit you into an upright position. That's orthopnea. Okay. Other terms: palpation, the sense of feeling, the sense of touch. So you have auscultation, the sense of listening. Palpation is the sense of touch, to palpate. Okay. Percussion is striking the body, typically with your fingers, and that's to elicit sounds. Okay, we can elicit bowel sounds, potentially for full or empty bowels, potentially lung sounds. So that's percussion. And you guys can read some more of those. Some more of the respiratory patterns, some of the common terminology. Apnea is the absence of breathing. Most of you have probably heard the term sleep apnea, and that's when somebody is not breathing during sleep. Most of us have some apneic episodes during the night, and that's fairly normal. However, sleep apnea could potentially lead to sudden death if breathing doesn't resume during sleep apnea. Okay. Bradypnea is unusually slow, irregular respirations. If we go back and remember that brady or brady is decreased and tachy is increased. So bradypnea is decreased respirations. Oftentimes happen when we sleep, when we're at rest. Okay, so tachypnea is the opposite. It's abnormally rapid respiratory rate. An adult, normal respirations for an adult is 12 to 20 breaths per minute, respirations per minute. So bradypnea would be considered less than 12 breaths per minute. Tachypnea would be considered more than 20 breaths per minute. Okay. Let's see, different breath sounds. Okay, crackles are sometimes called rales, R-A-L-E-S. Okay, that's a good one, a high-pitched breathing sound. Rhonchi are low-pitched breath sounds, so crackles are high-pitched, rhonchi are low-pitched. The rhonchi is typically like these kind of low-pitched bubbling sounds, and primarily on exhaling. Okay, wheezes, high-pitched whistling sound, which is caused by a narrowing of the bronchial tubes, and then stridor is a harsh vibratory sound caused by the narrowing of the upper airway. So a harsh, and it's typically on inspiration. Okay. So stridor usually happens when we're taking breath in. Okay, diagnostic test. Probably the most common is a pulmonary function test. A pulmonary function test, it's a series of measurements. Okay, I've performed many PFTs over my career, and you get all of this information, and I'm not going to define each and every one of them. I know on page 269 of your text, it has a little bit more of the definitions of these things, but this is a very in-depth look at your overall lung health. Okay, most people that do this, when I do this, usually we do this 3 times with the patient at like 3 consecutive times. We have them take in a deep breath, and then we have them blow out as long and as hard as they can. Okay, now if I was in a medical assistant classroom or in a nursing classroom and I was teaching how to do this, I typically demonstrate it. And I always encourage you, if you're doing direct patient care, to demonstrate these things for patients. If you don't, they typically won't do them correctly, and we're wasting a little bit of time. It's not very efficient. So it's take a deep breath in, and then blow out as long and as hard as you can. So it should be something like this. And you have them do that usually 3 times. And then these measurements are averaged out over the 3 of those. And then we come up with a good overall picture of lung health. Now, some patients, when we do this, will actually start to pass out on you. So that's important. And usually we have patients stand up so that we can elongate the lungs. So you need to be very aware of your surroundings, very aware of how the patient is feeling when they're doing this. Oftentimes I'll have them stand, do one, and then sit for a minute, and then have them get back up again, because if they get really lightheaded, I don't want them to pass out on me when we're doing this. So that's a PFT, okay, or a pulmonary function test. Other things we do, of course, imaging studies, chest x-rays are great for looking for potential problems like tuberculosis, collapsed lung, that type of stuff. So we're looking at soft tissue. MRIs are wonderful for getting a little bit deeper into the layers, as well as CT scans. Okay. Arterial blood gas measurements, which is where we actually draw blood to check the acid balance with carbon dioxide and oxygen levels in the arterial blood. Okay. Bronchoscopies, a bronchoscope is used to look at the tracheobronchial tree. Okay. Culture and sensitivity tests are great if we've got somebody where we suspect maybe they've got some kind of an infection in their lungs. What we'll oftentimes do is have them cough up sputum from deep inside. So not just spit, but sputum deep inside, that mucousy kind of nasty stuff that people can cough up. We want them to cough that up, and we'll send that to the laboratory and have them culture that and see if there's any bacteria in there. Okay, and then lung biopsies are wonderful for things like where we're looking for something like maybe lung cancer, and we need to take a tissue sample to look at that under the microscope and possibly identify and make a diagnosis that way. Okay, let's see, arterial blood gas results. These are the different problems that people could have upon getting their arterial blood gas taken. So we look for things like respiratory acidosis, respiratory alkalosis, okay, and then metabolic acidosis and metabolic alkalosis. Okay, other tests that we do, pulse oximetry, or I'm sorry, go back to the PFT for a second. Oftentimes PFT or pulmonary function tests are also called spirometry tests. I forgot to mention that. So your pulse oximetry, a lot of people have had that done. It's that little non-invasive deal where we put a monitor on your finger and we're actually checking the oxygen saturation in the bloodstream. Okay, and oftentimes this is used for real quick checks on people that may be having some kind of respiratory distress. And here in California at sea level, the reference range for a normal pulse ox is different than where I came from. I came from Denver, Colorado many years ago, and Denver, Colorado is over 5,000 feet above sea level, whereas here in Southern California, most of us are residing somewhere closer, much closer to sea level. Okay, so the pulse ox normal range is different than if you were at altitude like Denver. Okay, so 95% or better on your pulse oximetry percentage, where 95% or more of your blood is being fully oxygenated, that's normal. Okay, in Denver at 5,280 feet elevation, we consider 90% or more to be normal for a pulse oximetry, and that's because we're at a higher elevation. Okay, sputum analysis, already talked about that one. Okay, looking for bacteria. Thoracentesis is where we put a needle in to aspirate fluid from the parietal cavity, and then we'll examine that at the laboratory as well. Okay, respiratory disorders, acute bronchitis, inflammation of the bronchi, common, okay, very common to see. Acute respiratory failure caused by an inadequate exchange of oxygen and carbon dioxide. Okay, acute respiratory distress syndrome, it's a form of pulmonary edema, pulmonary fluid buildup leading to respiratory failure. Atelectasis, wonderful term, atelectasis. It says the absence of air in a portion of the lung. That atelectasis is a fancy term for a collapsed lung, and that could be a complete or a partial collapse. Okay, so atelectasis, that's a great term. Okay, chronic obstructive pulmonary disease. This is a kind of a catch-all term. COPD is what it's oftentimes abbreviated as. Okay, you've probably heard that. So it's a group of diseases marked by resistance of airflow, and some of those diseases may include asthma, chronic bronchitis, and emphysema, and those would all be considered COPD, okay, or chronic obstructive pulmonary diseases or disorders. Okay, other diseases and disorders, croup, childhood disease, which we see fairly frequently in young children, typically are kind of, I would say, our preschool age and younger. We'll see more incidents of croup. Hemothorax, blood in the pleural cavity, okay, not good. Cystic fibrosis, which is an inherited disorder that causes real severe damage to the lungs, the digestive system, other organs of the body. So this is a very serious disease process that needs fairly frequent monitoring. And then cor pulmonale, which is kind of interesting. It's a hypertension in pulmonary circulation that leads to an enlarged right ventricle. So it's a condition that's basically we would say it's right side heart failure is what cor pulmonale is. Okay. Other disorders, hypocarbia, hypoxemia. So hypercarbia is retention of carbon dioxide. Hypoxemia is deficiency of oxygen in our arterial blood. Okay, so that would be a reason we would check, or a diagnosis that could come from doing something like the pulse oximetry, where we measure the oxygen in the arterial blood. Okay, Legionnaires disease. Let me hit that one in a second. Lung abscess is a lung infection with pus accumulation. Pleurisy is inflammation of the pleura. Okay, and it usually causes chest pain. Okay, and sometimes these respiratory diseases or conditions can be confused with a cardiac condition. So this is why we have patients come into offices, so that we can do examinations on them, so that we can rule one thing out and rule something else in. Okay, make a determination as to whether something is respiratory or cardiac in nature. Legionnaires disease is an acute type of pneumonia, and it's very severe. Okay, it's caused by an infection. Okay, it's caused by a bacterium known as Legionella, and it says most people catch Legionnaires disease by inhaling bacteria from water or soil. Okay, pneumonia, acute infection. Pneumothorax is when we have an air collecting in the pleural cavity, and that can lead to atelectasis. That can lead to a partial or a complete lung collapse. Okay, and it talks about the closed and open pneumothorax. And then pulmonary edema is that excess fluid buildup in the lung tissue or the alveoli. Okay. Pulmonary embolism, very important, can lead to sudden death. It's a clot in the lungs. Again, if somebody has a pulmonary embolism, they can present, their symptoms or their signs can present with severe chest pain. And again, we've got to determine whether this is a respiratory issue or a cardiac issue. Okay. Pulmonary fibrosis is scar tissue buildup in the lungs. And then we've got pulmonary hypertension and pulmonary infarction. Okay. And the pulmonary infarction, very important, the lack of blood flow to lung tissue that causes tissue destruction or death. Okay. Respiratory distress syndrome. We've got many other illnesses here: silicosis, tuberculosis, infection of the lung by the Mycobacterium tuberculosis, which most of us in healthcare get checked for TB fairly frequently. And then there's sarcoidosis, which is a systemic disease of granular lung tissue. Sarcoidosis is a fairly rare condition that causes small red swollen tissue called granulomas, and they develop in the organs of the body. It usually affects the lungs and the skin. Okay, and the symptoms depend on which organs are affected. All right, but they typically include tender red bumps on the skin and shortness of breath. Okay, different devices used for respiratory illnesses. Bronchoscope, of course, to visualize. A chest tube inserted into the pleural space. This might be for something like pulmonary edema. Endotracheal tube to deliver oxygen. Okay, nebulizers, very common, used to deliver moisture and medication to the lungs. We'll do this one sometimes for severe breathing issues. Stethoscope is used to listen to lung sounds. Different surgical inventions. Pneumonectomy, lung removal, thoracentesis is a needle puncture into the chest to drain fluid from the parietal cavity. Okay. Thoracostomy is a surgical opening in the chest wall, and a thoracotomy is a surgical incision in the chest wall. And it's funny because we have these two terms, ostomy and otomy. The way I typically like to tell you how to kind of keep these two things straight is this. If you look at the definitions here of thoracostomy, surgical opening in the chest wall for drainage. A thoracotomy, surgical incision. Well, an incision is an opening, right? But the way I keep them kind of separated is I always think of ostomies as being long-term or permanent openings. And an otomy typically being just an incision for something very short-term. Like in this case, it says to remove portions of the lung. Maybe for something like lung cancer, and we were going in to simply remove the cancerous tissue from the lungs, then a thoracotomy would be what that would be called. So think of ostomy as long-term, potentially permanent, and otomy being short-term, usually just a short-term opening that we're going to close fairly quickly. Okay. Ventilation therapies. This one obviously has been in the news with COVID-19. Of course, being a respiratory illness, our latest respiratory illness, ventilators it's artificial breathing for all intents and purposes, okay? And one of the things that you don't want to have happen, in my humble opinion, is that if you have a respiratory disease, the ventilator is typically the last option because we're going to artificially mechanically breathe for you. So you really don't, you want to try to avoid a ventilator if at all possible. So that's kind of how I look at it, is it's artificial breathing. It's not normal. It's not normal to be hooked up to a machine to keep you breathing. Okay, so this is usually last case scenario for most people having some kind of acute or chronic respiratory distress. Okay. Different drug therapies, antitussives. Antitussive is to suppress coughs or to keep coughs from happening. Okay. Antihistamines manage seasonal allergies and allergic reactions. I take an antihistamine fairly frequently for my seasonal allergies. Corticosteroids are used to reduce inflammation, decongestants to relieve swelling, to help rid ourselves of mucus, that with expectorants to help us rid ourselves of mucus. Okay, and then other therapies, oxygen therapy, drainage, ultrasonic nebulizers help to mobilize or allow thick secretions or thick mucus to move. Aerosol treatments delivers drugs by nebulizer. So if we were nebbing somebody for moisture and to get drugs into the lungs, that would be considered an aerosol, which is spelled incorrectly on your slide. There's 2 R's in there that one of them needs to be removed. It should be A-E-R-O-S-O-L, aerosol. And that will conclude Chapter 7, the respiratory system. So I look forward to seeing you again for Chapter 8.